My name is Jane Rosner. I am the founder of West Valley Hearing Center. I started West Valley Hearing Center in January of 2001. Prior to that time, I was one of those audiologists who had multiple part-time jobs. There were some days where I went one place in the morning and one place in the afternoon and did this 5 days a week. At one point, I decided that was not manageable anymore, so I took the big jump and opened my own practice as a solo provider. My undergraduate degree was in psychology, and after I finished my undergraduate degree, I decided I did not want to study psychology any further. I did not want to be a psychologist. So I worked for a year. I ran into a college friend and asked what he was doing, and he said he was in the communication disorders field, and I said, that sounds fun, I'll do it too. When I was in graduate school, I quickly found out that I did not want to be a speech pathologist, and I leaned much more towards audiology, which was more about equipment and numbers and people, but I felt much more comfortable in the audiology side of the field rather than speech pathology. We have 3 audiologists at our practice now. I started the practice, I am what we call the old audiologist, and then Dr. Gosalia came on in 2017. We call him the middle-aged audiologist, and then we have Dr. Montez who came on in 2022, and she's the young audiologist. So patients really have a choice whether they want old, middle-aged, or young. We have something for everybody. I have a long history of doing workers' compensation patients for multiple years, so I feel like that is kind of my specialty. Dr. Gosalia tends to do a lot of the personal injury patients, so we do split things up a little bit, but I think we're all pretty balanced in what we're able to do if necessary. I love working with patients when I know I have made a difference in their life, the lives of their significant others and family, making their lives easier, making their communication easier, keeping them in the loop at family events and keeping them from loneliness, which is a big problem right now. Keeping them active and involved makes me really happy for them. And I like seeing the smiles on their faces when they come in and say, my hearing aids are doing great. I'm hearing really good. I'm really happy when I see patients on my schedule who have come to us for hearing aids before and they come back to be refit. When they come back for the second time or even the third time or fourth time, it tells me that they trust us and they believe in what we're doing and how we're taking care of them. The vestibular system is the second part of the inner ear system beyond hearing. When patients have trouble walking, when they feel like they're leaning to one side or the other, when they feel like they need to grab the wall, that's an indication for balance testing. But also if patients are having true vertigo where they are spinning, they feel like they're spinning or they tell us the room is spinning, that is another strong indication that they need vestibular testing. We know now how important early detection of hearing loss really is. Hearing loss is tied very strongly to long-term cognitive function. And if we can find that hearing loss early and treat it, we can preserve cognitive function for longer. A patient's first set of hearing aids is often a very nerve-wracking experience for them. Some of them actually feel like they may not even need them and are forced to get them from a family member. I try to make it as easy for them and as comfortable for them as I can, stringing out the process to multiple appointments if necessary, or doing what they need to feel comfortable on the day of their initial fitting. I'm really happy when I see patients on my schedule who have come to us for hearing aids before and they come back to be refit. When they come back for the second time or even the third time or fourth time, it tells me that they trust us and they believe in what we're doing and how we're taking care of them.